Hello, everyone. Welcome back. If you are new to my channel, this channel is for you if you are looking for all information on things women's health and hormones. Today, we have a really special guest with us. Her name is Dr. Leslie Axelrod, and she specializes in autoimmune conditions. This is something that I get a lot of questions about in my practice. And I have a lot of patients who come in that will say things like, oh, I have an autoimmune condition. And then as we dig in further, they don't actually have an autoimmune condition. There's just a little bit of confusion around this topic. So today we are going to talk to Dr. Axelrod. She actually teaches rheumatology at the medical school that I graduated from. So she's very, very knowledgeable on this topic. And this is going to be one of a series of videos where we're going to break out into some of the actual specific autoimmune conditions. But today we're going to be going over kind of the basics. How do you know if you have an autoimmune condition, or when even should you be looking at this? So welcome, Dr. Axelrod. I'm so excited to have you on.
I'm excited to be here. Thank you.
Absolutely. So yeah, I just want to dive right in. So I'd love to start just talking about what it actually means to have an autoimmune condition. Like, what does that mean to a patient?
Well, let me just start with what a healthy immune system looks like is that we will fight off infections, and we look at the external environment and try to protect it. And so when there are things like infections, viruses, bacteria, environmental toxins, the body starts to react with an immune response. It's normally just functioning and keeps us healthy and keeps us from getting sick, but sometimes that immune response just keeps going and doesn't stop when it should. And so then it may start recognizing those viruses and bacteria as self and attacking self. And that's where the immune system starts to cause problems for people, and an autoimmune disease might start up.
Perfect. So can you give me an idea of like, when should a patient be thinking that an autoimmune condition might be something that they should be investigating?
Well, one of the things is looking at your overall health and if it's declining. So somebody who may be starting to get really fatigued, there are actually something called constitutional symptoms. And so if you start losing weight and you're not really trying to lose weight, if you start noticing you get fevers or really tired, or a loss of appetite, those may be some things to lead into it. There are a lot of different types of autoimmune diseases. I do a lot more with rheumatology, which is more joint related, but there's neurologic immune diseases such as multiple sclerosis, even the type of diabetes that can be immune related. And so people may have very different symptoms. Things like lupus, rheumatoid arthritis, you're going to expect some joint pain that goes along with that. People who are a little bit older may get something called PMR, where they actually have a lot of muscle pain, or for instance, fibromyalgia might be a lot of muscle pain as well. And so when it becomes, you start having symptoms, and then you start having some of those systemic or constitutional symptoms with that, and the extreme fatigue and so forth, that's when you probably want to go see someone and have them evaluate you and look and see if it is an autoimmune.
Definitely. And so I think that's really important to point out, because that goes back to what I was saying at the beginning. I have a lot of patients who come in that will say, I have an autoimmune condition. And sometimes they do, and sometimes it's not actually autoimmune. So one of the most common autoimmune conditions that comes in my office is Hashimoto's, thyroid, but it is a very different, I feel like Hashimoto's is very different in its behavior than some of the more aggressive autoimmune conditions in terms of like lupus and rheumatoid arthritis and things like that. And then there's other autoimmune conditions like celiac, for example, that puts you at risk for future autoimmune conditions. Is that correct?
Yes, and I agree. There are a lot of people with Hashimoto's. And so let me just start with Hashimoto's.
Yeah.
What Hashimoto's is where somebody starts to develop antibodies that are attacking the thyroid. Some patients will come in, the majority of patients will come in with hypothyroid condition. And hypothyroid a lot of times will present with things like hair loss, fatigue, weight gain, constipation, maybe some memory loss, and also feeling cold all the time. That's some of the big symptoms. And then if you have hypothyroidism, your doctor's then going to test you and see if you have antibodies to the thyroid. Mm-hmm. I do have a number of patients that come in with just the antibodies, and they actually don't have the low thyroid symptoms yet
Yes.
with that. Or I have patients that just have the hypothyroid aspect of it. The thing about Hashimoto's is a lot of patients come in and they believe that their Hashimoto's is the cause of all of their illnesses. And a lot of times when they do come in with Hashimoto's, I am looking broad spectrum at all different things, because there are definitely people that come in and have Hashimoto's and a lot of their symptoms are attributed to that. But I have to say that the majority of patients that come in for me with Hashimoto's, there are other things going on. Maybe their adrenals are not functioning as well, or maybe they have hormonal imbalances or dietary issues. And so I'll look at that big picture. So Hashimoto's tends to be a little bit different than some of these other conditions like lupus and rheumatoid arthritis. Whereas lupus and rheumatoid arthritis are these systemic issues that really affect the whole body. And typically, if you've been diagnosed with rheumatoid arthritis or systemic lupus, there's going to be multi-systems that are affected. It's not just one system. So rheumatoid arthritis, we think about the joints, but also sometimes actually the lungs can be affected, and there's joint destruction that happens. Or lupus, there's a number of different things that you're going to be looking at for lupus as well. In addition, like for instance, lupus a lot of times does have joint pain with it, or it may have some other things like sensitivity to the sun and rashes. So you're looking at a bigger picture for some of those.
Yeah, I think what you just said is so important in terms of paying attention to the fact that just because you have a diagnosis doesn't mean that that is the cause of every single thing going on in your body. I think that oftentimes I see it in my practice. I don't know if you see it in your practice, but I see it in my practice a lot where patients come in and their labs are just so tailor focused on their one issue that there's a whole bunch of things that are missed. Like cortisol is often missed in patients. And in thyroid, I see antibodies are often not run. Do you see that where you have hypothyroid patients that actually do have Hashimoto's, but nobody's ever actually run their antibodies?
That's true. And one of the things that we do is naturopaths is a lot of times we will decide on what type of medication. If somebody is hypothyroid, we'll try to do naturopathic therapeutics and get them better with naturopathic therapeutics, but there is a time and a place where they may need thyroid medication. And knowing what's going on with their antibodies can help us make a decision with that. So for instance, if somebody has antibodies, they may not do as well with the natural glandular thyroid medications because their body's already attacking the thyroid. So you have to be especially careful with that. Also, the other thing about the antibodies is it takes a while for them to change, and people a lot of times will get better even when their antibodies still stay a little bit on the elevated side. So quite frequently the antibodies don't come down to zero, but you can get them down with some of the naturopathic therapeutics.
Yeah, and watching that and having that be part of your measurement process, so to speak, I think is really, really important. So when we're talking about kind of some of the rheumatological autoimmune conditions, I do want to talk a little bit about when you should be thinking about getting tested, which we talked a little bit about that with the constitutional symptoms and things like that, but also how to get tested. I know that when it comes to autoimmune conditions, especially the rheumatological autoimmune conditions, sorry, I apparently can't say that today, they require this symphony of symptoms and diagnosis, like symptoms and labs. So can you talk to me a little bit about that?
So the rheumatological conditions, most of them have what's called criteria attached to them that you have to meet. Then they use a lot of those criteria for research, and physicians and clinicians can use those as a guide. But those criteria, so for instance, lupus has 11 criteria to meet, and you want to meet 4 of those criteria, and those criteria may include things as joint pain, as I mentioned, rashes, sensitivity to the sun. They might get aura ulcers, and these are some of the, or hair loss, and these are some of the key symptoms that you would expect to see with a lupus patient. And so, and then there's an array of labs that typically will go with that. It's very common, I'm glad you mentioned that, is especially with lupus, that I'll have patients come in and they had some joint pain or they didn't feel quite right, and their doctor did what's called an anti-nuclear antibody. That's an ANA. And that comes back positive. And that is one of the things, actually, one of the criteria that they actually changed for lupus, that you pretty much should have a positive ANA. And it'll come back and their doc or their clinician will say, you've got lupus because you have this positive ANA. Well, ANA is positive in a whole array of diseases other than lupus. And they say it's also positive in certain normal patients, or with aging, or actually even Hashimoto's, you can have a positive ANA with that. And so you can't diagnose just on one disease process or one lab per se. Really, an astute clinician is going to come in and they're going to take a good history. And most of the information you're going to get is from that history. Sometimes labs aren't even positive. You could have rheumatoid arthritis in the early stages where the labs aren't positive, and as it progresses a little bit, it becomes positive. And so really that history is such a key factor. And really, it's hard to you shouldn't be diagnosing just on one lab alone. It's the pieces of the puzzle that you're putting together to make that diagnosis.
Yeah, absolutely. And that was a conversation I actually just had with my patient the other day, because we are running an ANA on her. And the very first thing I said was, if this ANA comes back positive and it refluxes, so what happens when you run ANA is, if you run it with a reflux, it basically runs as a catch-all antibody, and then it refluxes to the very specific antibodies for very specific conditions. So I was explaining that to her, and I told her outright, I said, if this refluxes to specific antibodies, then I would want you to see somebody that specializes in autoimmune conditions so that you can get the best care, because that's something that you really do have to look at symptoms and have to look at progression. That's why sometimes, especially with lupus, I see this a lot with lupus, where patients will end up with like a quasi-diagnosis almost. Like they're not stamped lupus, but they're not lupus. And so they'll run around and they'll go, well, my doctor said I could have lupus, right? And it's exactly that. It's that they don't have enough criteria to actually meet the solid diagnosis. Is that correct?
Absolutely. And yes, and I see a lot of patients with that, exactly that. As my doctor said I had lupus, don't quite fit the criteria. I think one of the things that happens is patients come in and they have this picture of this lack of health, and then they have some positive ANA. And for me, what that means is, but with that history, do they have a family history? So if there's a genetic link, a lot of times actually they still may not have that condition, but they may be predisposed to that. And so when those folks come in and I feel like they are predisposed, and it's possible that they might have something that just sort of clicks them into that. Maybe there's a high stress, or they're eating really terrible diets, or they're not getting sleep, or some of those lifestyle things, or just major stress, or a divorce, or anything like that, that might put them over the edge. And so it's our job, and that's one of the wonderful things that naturopaths have, is that when we have somebody who walks in the door and they have this predisposition, but they're not there, we can do all kinds of things to keep them healthy and help prevent them from moving in that direction.
Yes. And that is one of my favorite things about what we're able to do, is that you don't have to send somebody away because they're not at the exact edge, right? There's a lot that you can do prior to that. The other thing that I think is really important to notice, which you and I were talking about before this call, is that with autoimmune conditions, it is the body attacking self, right? It's the body attacking itself, and not being able to recognize invaders and recognize things that are now pathogenic to the body, and getting confused, so to speak. But there are some changes in hormones that also happen with autoimmune conditions. And so we were talking about one of the questions that I get a lot from autoimmune patients is why their sleep's affected. And you mentioned cortisol. And you kind of mentioned cortisol a little bit earlier, but can you talk to me a little bit about some of maybe the hormonal changes and why it's important to not just look at the antibodies?
So some of the hormones that are happening are, as far as cortisol with our sleep, so the adrenals put out cortisol and they regenerate when we sleep. And a lot of times patients that are fatigued, their adrenals have been burnt out. How do you get burnt out adrenals? Well, burnt out adrenals, let me just clarify, because there is this whole aspect of adrenal insufficiency, or where the adrenals really burn out and are not functioning. Their adrenals have been taxed with stress, which we all live. Look at what we're living through right now. I imagine by the time we're all out in the open and COVID is over, everybody's adrenals have been affected on a significant level. So what happens is when we sleep, about 3 o'clock in the morning, the adrenals start kicking in. They sort of get rested, they're sleeping, we go to bed. Actually, melatonin is picks up between 8 and 10. That's about, you should go to sleep about by 10 o'clock at night. And that's the time that most people fail asleep the best, and that you should be getting your 8 hours of sleep. And so the adrenals are starting to get regenerated a little bit. And by 3 o'clock in the morning, they really start pumping out that cortisol. And so by 8 o'clock, that cortisol is the highest that it's going to be during the day. That's actually the time that's the best for you to exercise, feel energetic. And then it stays it's the highest there. And then as the day progresses, it starts to move down. And then it drops right before you go to bed. And so it's actually not the best time to exercise before to go to bed, unless maybe you're doing some regenerative yoga or something that's a little bit more relaxing. Because if the cortisol is high before you go to bed, or maybe you're having some anxiety, or you're watching TV, or some crime shows, or whatever it might be, you're looking at your day statistics on your iPhone of what's been happening in the world, that's not probably the time for you should be doing that. You should be taking a 2-hour break, let your cortisol drop so you can really fall asleep. And then that cortisol can regenerate itself throughout the day. Otherwise, what happens is the adrenals go into high gear, and the adrenals go into high gear with fight or flight, survival mode, or when you're stressed. And so otherwise, so with that cortisol's high, it's hard to fall asleep with it. So, and different conditions. And one of the things of getting well is you have to have the sleep. That is a key factor. And there are certain autoimmune conditions or rheumatological conditions such as fibromyalgia where sleep is really affected. And with pretty much any chronic condition, sleep is a key important factor.
Yeah, absolutely. That is one of the things I always talk to my patients about, even with hormones, because we know that you make the majority of your testosterone when you sleep as well. Like that's when your testosterone LH spikes and you start to create testosterone. And if you don't have enough sleep, cortisol is going to be off, which you just talked about. TSH, studies show that TSH rises pretty significantly if you're getting poor sleep, and same thing with testosterone. Testosterone will lower with lack of sleep. So that is a huge component in getting well. That's one of the things that I love that you've said is that idea of getting well, because it's not just treating one specific thing. It is like, yes, it's important to get a diagnosis. It's important to treat what you have, but it's about kind of overall health. Can you talk to me about what other things should patients be thinking about in terms of their overall wellness when they have an autoimmune condition?
Food is a key factor. What you put in your body affects your whole body. And so basic diets, I know everybody's got a little bit different fad diets these days, where this is, or the one that they think is really the most healthy. I think eating just high vegetables, high water intake, good quality organic proteins are healthy. There are some things, some people have food allergies. Actually, quite a lot of people have food reactions. Some of these are caused possibly by dysbiosis in the gut, not having good microbes. Maybe if you've had antibiotics in the past, maybe, or eating under stress, where you're not having the digestive enzymes to break things down. And as people age, those digestive enzymes actually also diminish. And so people do develop some sensitivities to food, and looking at that can be helpful. And there's different kinds of sensitivities. There's the IgE reaction that most people think about of a food allergy, where they do skin prick testing. But there's also delayed sensitivity, where maybe today you eat something and you have a nice grilled cheese sandwich, and then 2 to 3 days later, you've got a bad headache and your sinuses are congested. And so it's helpful to figure out what those are. Sometimes I'll do elimination diets with people, or we do a blood testing where you can find out close to 100 different foods that you're reacting to, and I'll have people eliminate those, and then figuring out which ones really are causing the problem. I do have a number of patients, and it is a key factor, is figuring out what foods are causing a problem for you with that. And so you can do some of that. I'll say the main ones that So I do food allergy testing, but the main ones to play with, maybe wheat and dairy are key. And there's a lot of issues that are found with gluten and the casein in dairy.
Mm-hmm.
Actually, interestingly, almonds are a problem for a lot of folks. And so, because everybody's going towards almond milk and almond
Yes.
butter, and that's such a great dairy substitute because everybody's going dairy free.
Yep.
So looking at your foods can be very, very helpful for patients. And I will have patients, rheumatoid arthritis, that will have a flare of their rheumatoid arthritis when they have eaten foods that are problematic. And so it's a key aspect in there.
Yeah. And when I do food sensitivity testing with patients, it's really the testing of the foods that makes a big difference. Sometimes I find with autoimmune patients, it is harder because like with Hashimoto, sometimes they don't have physical symptoms, but it does impact their antibodies. But with me, I mean, even with me, when I did my food sensitivities, I really thought it was mostly dairy. And, you know, dairy, I have to be careful with. Almonds are a huge sensitivity for me. And it wasn't until I was super clean, my diet was on point, I felt amazing. And I went and one day grabbed a perfect bar, an almond perfect bar, just thinking, okay, this is easy, I'll grab this. And I was a mess. I felt terrible the rest of the day. And I have not touched an almond since. It's not worth it. And so a lot of patients do go to that as a healthy food, and they don't realize that even sometimes the foods that are deemed and tagged healthy aren't necessarily working for their body individually. Do you?
I just, oh, I'm sorry.
Oh no, go ahead.
I was just saying I did sensitivity testing on myself a week ago,
Mm-hmm.
and it was rice for me, and I was just in shock because rice is my go-to. Rice cakes and almond butter, and and so rice and almonds, and so it was very surprising. And a lot of times it does. Admittedly, it comes up that foods that people are craving, and I think one of the things that happens when we crave foods that we are reactive to, our bodies have this little bit of a buzz of a response to those foods. And we may feel a little bit better initially, but then afterwards we don't necessarily feel so good.
Absolutely. With things like Hashimoto's patients, have you seen antibodies respond well to removing food sensitivities?
I see the antibodies come down. I do food sensitivities, and actually sometimes I'll do something called Naltrexone, low dose Naltrexone.
I'm glad you mentioned that. I wanted to ask you about that, so I'm glad you mentioned that. Keep going.
Yeah, and I will see them respond. I have to admit that I don't always see those antibodies go away, but I do see people feeling so much better, and that's really my key. I'm not always looking at the numbers, but I do take those into account for sure. What I'm really looking at is people feeling their best and feeling their optimal, and that's really my goal, is people to, as we said, feel well.
Yes, absolutely. That definitely makes sense to me. Low dose naltrexone. Are you using low dose naltrexone a lot?
I am using it more and more on my fibromyalgia patients. There's some really nice studies with fibromyalgia for Hashimoto's patients. One of the things that I'm using it more and more for are those patients, those sort of patients we were talking about, those in-between patients that have some evidence of autoimmunity, but we can't categorize them into any particular condition. And so maybe they have some lab tests that are positive, and they have some fatigue, and maybe there's a family history, or maybe not. I'm really having some very nice results with low dose naltrexone with those patients. It's also been shown to be, and I've had some good results with inflammatory bowel diseases like Crohn's and ulcerative colitis as well. But fibromyalgia and Hashimoto's are two of my favorites that I'm using it a lot for. Maybe I see a lot more of those patients as well.
Yeah, absolutely.
Rheumatoid arthritis, I have not seen as good a results as I would like to with rheumatoid arthritis.
Okay.
I think and that's a tougher disease, and I think there's a bigger picture along with those.
That makes sense. Low dose naltrexone, my understanding, I use low dose naltrexone a lot in my Hashimoto's patients. And the research in certain autoimmune conditions like Hashimoto's, I believe it's researched even in things like SIBO, small intestine bacterial overgrowth, which isn't necessarily a set autoimmune condition the way that you think it is, but it still has an autoimmune component because it is degrading the intestinal lining. And it's really well researched in SIBO, well researched in Hashimoto's. That's interesting in fibromyalgia. I didn't actually, I mean, I don't treat a lot of fibromyalgia patients, but I could see it being really great for them.
Yeah, and the other thing with SIBO is it helps with gut motility with SIBO.
Yeah.
And so you can treat SIBO, looking at the big picture for SIBO, which is small intestinal bacterial overgrowth, that people have a lot of bloating with that and gas. And a lot of times those patients actually don't do well with probiotics. And so one of the things is that you treat it with an antimicrobial protocol, but you want, sort of, I look at which came first, the swamp or the mosquitoes. You really want to clean up the swamp. You want to clean up your digestion and make it as healthy as it can be, so that way those bacteria don't come back. And low dose naltrexone works on this autoimmune aspect and this immune function, but it also helps to improve the motility of the gut so that things don't get sort of stagnant in there and bacteria like to grow.
Mm-hmm.
So
yeah,
that is one of the ways that low dose naltrexone works there.
Yeah. And with gut dysbiosis, you mentioned gut dysbiosis as being one of the major contributing factors, or one of the contributing factors in autoimmune conditions. When you're saying gut dysbiosis, so small intestine bacterial overgrowth, or SIBO, is a big one. I'm assuming candida, intestinal candidiasis would be a big one. Are there any others that patients should be thinking about?
Well, there are all kinds of different bacteria that can grow in the gut. And so you can do a stool analysis and things like Klebsiella, Proteus. There's actually a lot of studies now. It's all over the literature of autoimmune being related to the gut dysbiosis. And actually, rheumatoid arthritis is one of the big ones that they're really looking at, the oral microbiome. And the bacteria in the mouth have been shown to be in the lungs of rheumatoid arthritis patients, which tend to they do have a sort of silent lung disease that goes along with them, called interstitial lung disease. And so these bacteria can affect and bring on rheumatoid arthritis. Actually, two of the main factors that they're looking at now is smoking and oral dysbiosis. And patients who have, for me, who have a family history of rheumatoid arthritis, and they may not exhibit rheumatoid arthritis, or maybe we run their labs and they're positive, but they don't have the disease process.
Mm-hmm.
I'm having them actually do something called coconut oil pulling, where you actually swish coconut oil around, because coconut oil actually kills those bacteria that are associated with rheumatoid arthritis.
Interesting.
So I'm doing that preventatively. So yeah, and even there was a study showing even 1 minute of coconut oil pulling, because I think it's like 5 minutes is sort of standard, but it doesn't take much to swish it around in your mouth for a while and to change that and keep a healthy microbiome in the mouth.
Yeah. I am so glad you brought that up, because I think that there's a lot of things that people do in terms of like their oral health that could contribute to other things. For example, right, oftentimes people will do stronger mouthwashes, like an antibiotic kind of mouthwash, right? And people don't realize that there's good flora in your mouth. And even Dr. Hernandez, at one point, his dentist said, "Oh, you should take this mouthwash." And he actually asked the dentist, "Well, will this affect the good flora in my mouth?" And the dentist said, "Oh, no, it won't affect the good flora at all." And it just doesn't make any sense. I think it's catching up in some of the literature, but it's something patients don't think about. And then I'm glad you brought up, I'm glad we're talking about the gut dysbiosis piece, because one of the things that I get asked a lot is with the GI concerns and, increasing in food intolerances, GI bloating, constipation, all of those things that come along, and patients tend to notice a little bit more when they have autoimmune conditions. And in those cases, I usually tell patients it's because they probably need another set of tests to figure out what's going on in the gut. Is that what you would recommend as well? Like there's probably two processes going on?
Absolutely. So there's tests for you talking about SIBO, which is a breath test, which is your small intestine, but you also can potentially have dysbiosis in the large intestine. Mm-hmm. And I was starting to mention Klebsiella and Proteus, and there's all kinds of different bacteria. I think when we talk about dysbiosis, some people think about abnormal microbes like Salmonella or E. coli are the ones where you really get significant diarrhea, but
Uh-huh.
patients may have sort of these ongoing low-level chronic infections. We normally have bacteria in our gut. But they're typically well controlled because we have this fine balance between good bacteria and bad bacteria. So if our good bacteria get killed off, maybe an antibiotic, or actually could be some natural substances too. I have patients that take oregano oil all the time. Well, oregano oil is an antibiotic and kills good bacteria as well as bad bacteria. So you have to be careful on what you're taking. You shouldn't really be taking essential oils internally unless you've really been prescribed that, because they do kill off the good bacteria, and it's this fine balance of when it's necessary and not. And so if those good bacteria are killed off, you're going to have those other bacteria start growing out of proportion and causing symptoms. Or you maybe people who have traveled out of the country or even camping, you may have some other parasites that you don't know about. And so looking and doing a stool analysis can be really helpful to
Mhm.
look and see what's really happening in the gut.
For your patients that have food intolerances, right, and autoimmune conditions, what's kind of your, so there's no secret number, I know this, but how many food intolerances would you say a person should have that's like a real food intolerance versus just inflammation, something else going on in the GI tract, a gut dysbiosis, something else that's going on in the GI tract that's causing their problems, as opposed to just the food intolerances?
I know when you get food allergy tests back, what they do is they grade it mild, moderate, severe.
Mm-hmm.
And my thought process and what I have seen clinically is I actually get patients off anything that they're reacting to give their gut a chance to heal, while I give them some different products to help that gut lining heal. And so I take away what's affecting and sort of causing chronic irritation, which is the foods, and then I add things in to help that mucosal lining just get happy. And
Mm-hmm.
so when you put the foods back in, you can tolerate more and more foods with that. And so that's mucosal lining a lot of times has become what's called leaky gut, because those junctions have become so inflamed in the gut that those junctions start opening up, and foods, before they're totally digested, can seep out, and the body then look at that and say, this shouldn't be here because it's not digested the whole way, and then attack it. And so you really want to get those gut junctions healed. But my experience is that those plus ones, even milds, can cause just as severe symptoms as the plus three. And they've actually had studies showing patients with migraines and patients with irritable bowel syndrome. There were two different studies where they did actually that IgG delayed sensitivity testing that I mentioned earlier.
Mm-hmm.
And they found out that patients even with the plus ones can have as severe a reaction as the plus threes. And I've seen that. I've seen people with asthma attacks and migraines and all kinds of symptoms. And so what I'll typically do is have everybody get off the food allergens, and then we'll start putting in systematically one by one and seeing, and you may find out that 80% of those foods you can tolerate. Maybe you shouldn't eat them all the time like you were, and
Yeah.
maybe there's just 10 to 20% that are really causing the problem. And all of a sudden it seemed almost impossible to get off those foods initially. And then all of a sudden at the end, when you realize that every time you drink that almond milk and you get a migraine, it's like, this is real easy just not to find an alternative to this food. And so it
Yep.
does become a lot easier when you know that this is optimally, you're going to feel the best.
Yes, it does. And that's exactly what I do with my food sensitivity patients as well. I do find sometimes with patients that come in that are concerned that they might have an autoimmune condition, they don't necessarily have an autoimmune diagnosis, but they're having a lot of GI concerns. They will be the patients that are off of a lot of foods for like years and years and years. So they'll come in and they'll list out 15 things that they think give them GI concerns. Do you think that that's, in those cases, I usually recommend additional testing because there's got to be something else going on. Is that what you would say too? Like, is 15 foods that you need to be off of for the rest of your life seem a little bit excessive?
That does seem excessive. And a lot of times it's less, and then it might be that they've had the in and they recognize it. But at that point, I'm really looking at some other things. Is there a gut dysbiosis that's causing this problem and this chronic inflammation that's happening? Or is it that their life is too stressful? and they need to cut back and look at what's happening in their life and their lifestyle or their relationships.
Mm-hmm.
Um, so, and find more supportive relationships. And so there's a lot of different things that contribute to what's happening with that gut. And even cortisol, that stress can affect the gut as well as the mood. Our serotonin receptors are all in the gut. And so looking at really that big picture, and that's where that history and as naturopaths, we take a long time taking a history to really find out and figure it out to figure out what pieces of the puzzle need to be put together and what other directions to really look at, and looking at the person as a whole, mind, body, spirit, all together.
Absolutely. Yes. Yeah, I think that's where people get the best care, is when you look at the whole thing. When we segment medicine into piece by piece, it just becomes really disjointed, and everything affects everything else. Awesome. Is there anything else, any other like tips you have for patients who are struggling, or anything else you want to tell people who are watching?
I think if you think you have an autoimmune disease, it's worthwhile to go and just talk to somebody and just get evaluated. One of the things that is in the holistic field and as naturopaths and so forth is we'll look at people before you get sick, and but your symptoms are your body telling you that you need to slow down and take a look.
Mm-hmm.
And one of the things that we do as naturopaths, we're not just trying to make those symptoms go away. We're trying to look at what's causing that and looking deeper and trying to heal from below up. We'll work with you to make you feel better. But at the same time, we want to see, why are you moving in this direction? And for you, you have the most control over your lifestyle, how much you sleep, what you put in, the relationships you have. Movement is such a key factor to keep things moving. And with exercise and doing things that you love and meditation, there's all kinds of apps these days that'll make that so much easier for you, actually. And that's just the simple things that you can do at home. We'll work with you and just help you with some of those symptoms along the way too. So
absolutely. Thank you so much for coming on. I really appreciate it. And then to all of our viewers, if you like the content we're putting out, make sure to like and subscribe to the channel, because we will be back next week with a video. Thanks again, Dr. Axelrod.
It's been a pleasure. Thank you.